Hi, I'm Amanda Andreas, and I'll be giving a presentation on Duchenne muscular dystrophy and mental health. Duchenne muscular dystrophy is a genetic disorder on the X chromosome which is characterized by severe progression of muscle degeneration and weakness. It primarily affects boys. This genetic disorder is characterized by an absence or presence of non-functional dystrophin protein. In the absence of functional dystrophin, muscle cells are easily damaged and muscle becomes weak and degenerative. Non-functional dystrophin is often produced by a mutation, which is an early stop codon that produces a non-functional dystrophin. Consequences of this disease are muscle weakness and degeneration. Muscle is easily damaged and pops, just like a balloon. DMD causes both physical and behavioral consequences. Physical consequences include difficulty mobilizing or loss of mobility completely. There is also an effect of reduced cardiac function and respiratory function, since those organs are also made out of muscle. DMD can become fatal. There are behavioral consequences as well. A study done in 2018 by Arbatini et al. Suggested that major components of cognitive function appear to be impaired by DMD boys regardless of IQ. Another study in the European Journal of Pediatric Neurology found that there's a higher prevalence of autism spectrum disorder, intellectual disability, and CBCL internalization problems. Behavioral disorders can lead to a disability of social assimilation and acceptance, which can take a toll on mental health. What is mental health? Mental health is a phrase that encapsulates one's emotional, psychological, and social well-being. Our mental health plays a role in every aspect of our life at every life stage. Mental health characterizes mood and behavioral disorders. One of the most prevalent disorders linked to DMD is depression. Depression is a serious mood disorder and affects a significant proportion of the DMD community. Patients affected by DMD, as well as their loved ones, can become depressed due to physical and social hardships of DMD, as well as emotional and financial burdens, respectively. A study published in 2015 by Conway et al. Found that among 765 males with dystriniopathies, 51% had depressed moods. They found that immobility was one of the primary causative factors of depression in these individuals, not being able to keep up physically with their counterparts. They also found in a 2004 study by the Pediatric Neurology Journal that parents of children with Duchenne muscular dystrophy had a higher probability of going through a major depressive episode. They also found that parents without a partner had lower scores on the mastery scale, and parents of males older than 13 of age were more likely to experience distress. Story time. Harry is a single father of two twin boys, Larry and Barry. When Larry and Barry were 2 years old, Harry notices drastic developmental differences between his two sons. Barry has trouble keeping up with Larry, physically and intellectually. Harry takes Barry to the doctor, where he is diagnosed with DMD. Harry struggles with the news as a single dad. As the boys age, Larry grows tall and Barry becomes wheelchair-bound. Seeing his brother living his life to the fullest as he struggles to do everyday tasks takes an emotional toll on Barry, and he becomes depressed. Harry and Larry notice the change in Barry and let him know that they are there for him and encourage him to seek help. Attend therapy and support groups where he can be with individuals just like him. In the end, Barry learns he is not alone and becomes happy again. He knows that he is strong and capable of anything. He could not have done so without the support of his family and loved ones. If you or a loved one affected by DMD or not are struggling with mental health, just know that there is so much preventative care that is out there. Counseling, professional psychiatric treatment, medication, support groups, communication is key. Never struggle in silence. Thank you.